Hi everyone. I hope, as always, that the mic works. Alright, give it a couple of seconds. Hello. And we begin. I know it's lunchtime. People could be working. Alright. So we begin, and you can watch this live also as a recording because it's a very informative live. It's for your information, so whenever you have time, you can watch it. So just for those who don't know me, just in case, my name is Anastasia Ovarova, and I'm a pelvic floor physiotherapist. I'm practicing in Cyprus, in Nicosia. And today I would really like to talk about online pelvic floor physiotherapy. Because as we know, especially after the pandemic, things went online massively, and healthcare is not an exception. Me, myself, I have been consulting professionals online that I haven't actually ever met live, and they help me tremendously. But what about such a practical, hands-on specialty like physiotherapy, especially pelvic floor physiotherapy? So today I would like to talk about how I do it, because I do have experience in online pelvic floor physiotherapy, and would like to talk about a little bit practicalities and how it can help you, and then you can decide whether it's worth it or not. I myself receive a lot of messages and requests. Some people are from Cyprus but from other towns. Some people are from other countries, and they ask if I practice in another town, if I come to Limassol, if I come to Larnaca, and so on. No, guys, I don't. I'm very busy here in Nicosia, and therefore online option can become feasible. But many people are very skeptical when it comes to physiotherapy. So today, step by step, what to expect from online pelvic floor physiotherapy. So let's begin with very basic. In order to actually be able to do online physiotherapy, you need a certain setup. You need to have access to good, fast internet, because if you have live consultation and there is all the time interruption of the internet, then it's going to be very frustrating and not effective at all. So the internet has to be fast. Now, don't ask me the mega bps. I think it's 100 now, the minimum. You can ask somebody more technical, or if you're a technical person, let me know. But it has to be fast internet, so when you turn on the YouTube video, it streams straight away. It doesn't need time to stream, so this is fast enough. You need access to a device, obviously. It can be phone, it can be computer, any device with a camera. Okay, it has to be with a camera. This is number 2. And number 3, there has to be some privacy. The place has to be private, and you will see why. So going to cafe and having pelvic floor physiotherapy consultation, even if you have a headset and nobody can hear what I'm saying, but we will be talking about a lot of very private stuff. I do believe that you need to have like a private space, a room at least. Okay, so when you have access to these 3, we can talk about online consultation, and we can set it up. We can set it up considering your time difference. If you are in a different country, all this can be arranged. Of course, if you do have a chance to come actually to pelvic floor physio even once, that would be great, and then it can also be continued online. But if you don't have a chance, for whatever reason, the reason doesn't really matter right now, you don't have, let's talk about the online. You can use preferred platform. I have myself used, for my personal consultation, I have used WhatsApp, I have used Telegram, I haven't used Skype, and Zoom. I prefer Zoom 100%, not an advertisement, because Zoom has option of recording session. I do give the person quite a bit of a details, and sometimes, so they don't sit there and write it down, they can actually listen to me, and then they can watch the recording again. So in all my consultation, I always ask a client, we can skip the assessment part, we can skip the recording, the assessment part, which I will talk in a bit, and then when it comes to advise the practical part, I ask them, do you want to record this part right now? so you can have access to it for the next, I don't know, 2-3 weeks. You can rewatch it again. And then I will delete recording when I run out of memory, which can be, several months, couple of weeks. So recording is just for you to have. And then I send you the recording link and password, so you can do it. So when a person is ready, let's say they're ready to have an online consultation about their pelvic floor issue. Let's take the most simplest one, the most common one, pelvic organ prolapse. Okay, a woman with a pelvic organ prolapse. I also consult a man, but we'll take a female just as an example. I usually send preliminary assessment form for them to complete, where I can see if they have been diagnosed by someone else, somewhere else, or they have not. So have they been to urologist? Have they been to gynecologist? Maybe they have been to other pelvic floor physiotherapists, to any other specialist, to their GP, any other healthcare professional that has actually seen them physically, maybe did some exams. It can be ultrasound, it can be MRI, it can be digital exam. So I see within the preliminary assessment form, if they have a diagnosis, that's great. That makes things a little bit easier, and you will see why just a little bit. If they never ever went to anyone, no gyno, no GP, no other healthcare professional, this is also for me important to know, and it doesn't mean that I cannot work with this person. However, there is a limitation. I will be basing my diagnosis only on the so-called subjective assessment, only on what you tell me, and therefore we will be trying to treat and help only the symptoms. Now, here is the big news. Whether you have urinary incontinence, stress incontinence, pelvic organ prolapse, pelvic pain, very often we begin with the things that are the same. So we're treating the symptoms based on your symptoms, okay? So there is nothing super new and super different for every single person. Yes, there will be variability, but quite often the basics are plus minus the same. So somebody comes for the consultation, they sit in front of me, and I'll ask them a lot of questions. There probably will be a little bit more questions than it would be in the room, because I will also be asking very specific questions about their pelvic floor, about their sensation. And when I will ask them, to breathe in or to stand up, to move, how do they feel? So I will be kind of digging a lot with the questions on what's happening, especially if they come to me very first time, never seen anyone else before. When they have a diagnosis, it's a little bit easier. So we kind of have our diagnosis in mind. Still, the assessment is very, very detailed. So asking their main symptoms and what is bothering them. This is the most important. This is not as important if you have grade 1 or grade 2 pelvic organ prolapse, or maybe you have even grade 3. Okay, it's a number. What is important to me? How does it affect you? How often it affects you? How does it affect your lifestyle? And based on that, we will treat you. Okay? So based on how you feel. Now, after we did our questions and assessment and so on, I will ask the person. Obviously, I cannot do internal pelvic exam. But besides internal pelvic exam, I want to see their whole body. I want to see how they stand. I want to see maybe how they move. I want to see them from the front, from the back, from the side. Very important for me, how they breathe. And I might actually ask them to do pelvic floor contraction and see how they do it. Are they using their whole body to do pelvic floor contraction? Are they squeezing their glutes? Are they breathing? Are they holding their breath? So all of this already gives me a lot of information, and this is where comes your privacy. You can't really go into cafe, because quite often I will ask you to stand with minimal clothes. It can be like shorts, very short shorts, and a crop top for a female, and just shorts for male. Okay, so looking at you, I might ask you to walk if this is relevant, and so on. And write it down in my notes. So therefore you need your privacy. After that, we get onto your symptoms, and based on your symptoms, we start to think about the strategies. Now, in the room, I spend about maximum 15 minutes actually touching person. If I need to do internal assessment, internal intravaginal, intrarectal assessment, touch the muscles and so on. I can also see the muscle tone from the outside. And the rest of the time we spend working on strategy, whether it's breathing, exercising, stretching, lifestyle changes. We're talking about how to, go on the toilet correctly, what they can do to help themselves. For example, have better bowel movement, or what they can do to help themselves to empty their bladder better, so they don't have that constant feeling that their bladder is never emptying. What they can do in the beginning of the day, in the end of the day, what they can do at work, and all these things can be shown. Now, when I teach people pelvic floor engagement, I will need to be very, very detailed and specific. So I describe to them where they should feel it. They should feel anal lift. Now, do they should feel around vagina? Do they should feel around the scrotum if it's a male? What the abdominal should do? So I talk a lot, right? But it's possible to teach many, many things. Also, I can teach people, and I'm just looking at, just give me a sec, guys. Just give me a second. Hello, I'm back. I can teach people to use like assistive devices, okay? For example, this is a pelvic wand that can be used for trigger points. And somebody who's maybe suffering from trigger points and they cannot do the treatment, they don't have access to this kind of treatment, to manual therapy, trigger point therapy, or assess if there is a certain trigger point, they can use the pelvic wand. Or maybe they can use a special device to help them, this is for female in particular, to help them with the rectocele and to help to better bowel movement. So we can talk about all of this. If somebody is having vaginismus and they need explanation and showing how to use dilators, no problem, because this is the same as I would do face to face, and this is the same that I will show them through the screen. Okay, so all these strategies, and then I will just ask them for a feedback, tell them what they feel around the pelvic floor when they contract, when they relax. Do they feel it? Do they feel the lift here? Do they feel the relaxation there? And through this communication, we can already have great idea. Most of the doctor would tell you that after doing subjective assessment, subjective is what person in front of you tells you, they should have 2, maximum 3 diagnoses in their mind. They should be like, okay, this probably is this or that. Now, the internal assessment is to confirm. Sometimes it goes against the initial objective assessment. It can be a little bit more complicated than that. Most of the time, it will go together with objective assessment. In my personal experience, I've been working with pelvic for 10 years. I can get a diagnosis from subjective 95% accuracy, and it will go together with the... Sometimes people might say they have tight pelvic floor and they have weak, or both together, tight and weak, and so on. But again, we develop strategies and we test them bit by bit, and we can do this through the screen. So, all in all, we need internet, we need the phone, we need to detail talk through the history. I will need to see you, and I can see a lot of things even without touching. And any healthcare professional who's been working in this field, looking at the bodies, working in the bodies, they can This is our kind of part of our job, to look, to visual assessment. And then we work on the strategies to reduce your symptoms. If it's a pressure around your pelvic floor, for example, or a burning sensation around anus, let's say, okay, we will start with certain techniques that will help to decompress the area. Now, is the burning sensation coming from the nerve injury? Maybe it's coming from the pelvic organ prolapse. I do believe this is important to know, and when you have a chance, you can confirm that. But right now, we want to help you to reduce that pressure. And whether it is coming from your nerve, let's say, injury, or your prolapse, we still will do the same thing. We do decompressive breathing, reversed movements where your bottom is higher than your upper body. We will start doing exercises there. We will start to see how we can adjust your toilet habits, and so on and so on and so on. So whether it's one diagnosis or another, the management strategy is the same. Okay? So all in all, in my opinion, is, of course, seeing somebody live is a gold standard, right? Because the person can actually touch and feel. When it's not possible, guys, absolutely go for online consultation, okay? If you have access to device and to the internet and to privacy, it can help you tremendously. And sometimes I spend a lot of times on educating people what's happening with the pelvic floor. Maybe they saw someone, and sometimes we discuss, what the other healthcare professionals, said. Reassure them, because maybe they received information that was so medicalized and full of terms, they're not even sure what's happening with them. So explain to them, reassure them. Or maybe they think that the operation is the only thing that can help them. Education, reassurance, all of this can make a person already feel better. It will take them out of that fear of doing anything. They're like, I need just to sit and rest. I'm scared to move. I'm scared to run. I'm scared to... Even giving them permission just to walk, or maybe do some stretches, maybe do their yoga, it's appropriate, or maybe their Pilates, or do some weights. Again, it might be appropriate in their case, or modify their weights so it becomes appropriate to their case. All of this can be done online. So, yes, online consultations, in my opinion, is absolutely worth it if you don't have a possibility to come live. I think that's about it. If you do have, guys, any questions, maybe something I forgot to tell, please let me know in the comments. I hope this video got saved. And thank you very much. We will see you very, very soon. Bye-bye. Have a lovely day.